I think most of you can come together, sitting in the back. I know 3 days holidays is there from tomorrow. Many of them absent. Today is the day we are celebrating the World Hearing Day, and I have a great pleasure to, in the absence of Professor Satish, I request the founder of this institute and also distinguished professor on atmospheric science, Professor Srinivasan, is a man with action, and we follow what he preaches. And I request him to inaugurate this session. Welcome to you, sir. Thank
you. Good afternoon. As all of you know, Dr. Paramesh has been organizing the monthly talk on impact of environmental health for the past 4 years. And we heard a galaxy of speakers covering the whole range of topics. But as far as I know, we never had noise pollution. Yes. Now, let me say a few words about noise pollution. Somehow in India, awareness of noise pollution is very small. And we consider noise to be a nuisance to deal with. And you'll hear from the Dr. Vijayendra kind of consequence of noise pollution. But somehow, in contrast to air pollution, which Dr. Paramesh has done a lot of talks about effort on lungs and so on, people don't realize that noise pollution has a huge impact on your blood pressure, heart, so many organs. Okay? Now, this is surprising. And when I tell people that India is one of the most noisy countries, they don't believe me. Then I tell them, you go out to the country for 1 week to a meeting or a conference, Europe or America, come back, get down and come out to the airport, you'll be hit by noise. Okay, I've had the experience. When I told this to my father, he couldn't believe it. I said, very different from the developed world. Our noise levels are unbelievable. That's why I'm sure Doctor mentioned that amount of people having deafness in India is much more. And so this, we need to educate people. We need, as a matter of fact, I would argue that like we're wearing our mask during COVID, maybe someday we should wear some earplug when it's a noisy area, because its consequence is very serious. Of course, in addition, we have other problems which I have faced wherever I stayed in Bangalore, is through the noise made by religious places. And unfortunately, the law is there. Professor Satish Dhawan made that law, not enforced. Okay. So we are lucky that we have one of the experts on hearing to tell us. And so I would request Dr. Paramesh to introduce him.
Thank you, sir. I once again extend a hearty welcome to you all for the World Hearing Day. And this has been organized by the DVHC Center Climate Change, as Professor Srinivasan said, for the past 4 years, once a month, and the last Thursday. And also along with the Lakeside Education Trust and International Pediatric Association, situated in Geneva, representing about 1 million pediatrics across the country. This record will go to them, sir. And just to sensitize the issue, that hearing impairment is a major burden globally and in India as well. It constitutes a substantial 5.3% of the world population and 4.6 to 8.8% in Southeast Asia. In India, 6.3% population, constituting of 63 million, have hearing loss, predominantly in the age group of 0 to 14 years. Children constitute a large percentage, and 1 in 5 children have a glue ear. That's the most common cause for deafness in children from the allergic rhinitis, most problem. And hearing loss is largely preventable, avoidable condition. Environmental pollution and noise pollution have an important role in causing the deafness. During the talk, we are going to have the risk factor, how to prevent it, what it is. We like to sensitize the issue with certain examples. To talk this important subject, we have with us none other than Dr. H. Vijayendra, and did his MBBS and DL1, Master of Science graduate from Bangalore University, and he's the university topper and has intense training in microsurgery under the guidance of late Dr. A. Mahadevaya, a great ENT surgeon of our country in Malleshwaram. That is Basungudi ENT clinic, was very well known. So all over the world, people used to come to learn his microsurgery. Dr. Vijayendra is an expert in micro ear surgery, laser surgery, facial nerve surgery, skull-based surgery, functional endoscopic sinus surgery, rhinoplasty, microlaryngeal surgery, hearing and rehabilitation. He presented more than 100 scientific papers at zonal, national, and international level. Some of them got the awards. And also he paneled a discussion on 20 occasions. He has done 117 live temporal bone dissection workshop all over the world with many awards and gold medals of many countries. And it's very interesting, and also we feel proud as Bangaloreans. And two of his technique surgery internationally named after him. Dr. Vijayendra technique of Bangalore technique. That is the technique of transnasal facial nerve decompression and technique of facial nerve grafting, sutureless grafting. These are all the two things named after Vijayendra technique of Bangalore. And we are proud, sir, for that one. And he, the visiting professor at ENT department at Jain Medical College, Kale University, Belgaum, BLD University, Bijapur, and the University of Illinois, Chicago, in United States of America. And he, the author of two books, A Color Atlas of Temporal Bone Dissection and Otology Demystified, a diagnostic atlas of echo endoscopy. He has done 5 live surgery workshops in Bangalore, Indian Institute of Science only, which all over the world, over 1,000 delegates comes every time. 4 days he conducts in the institute, that one. Last one, we co-sponsored it, Indian Institute of Science, the WHS and the climate change. We are very proud. 1,140 delegates came all over the world from 26 countries. They thoroughly enjoyed the technique and hospitality, culture, and our values. And I feel very proud of it, sir. I think we brought a lot of laurels to our country. And this year also, he is going to have in the month of June, and is already been booked. And we are definitely here going to use our institute name as in the brochure is going to all over the world. Vijay ENT Care Center and his team in Malleshwaram is a very well-known center globally. And I have a great pleasure extending invitation to you to address us, sir. Over to you, sir. Thank you.
Good evening, respected Professor Srinivasan sir, respected Professor Parmeshwar sir, and my dear friends, colleagues. It's a great pleasure and honor to be here to speak on deafness prevention. And I'm very happy to be associated with the Vecha Center for Climate. And with them association, we did a international workshop on last June 4th to 8th. That workshop is where I'll be doing live surgical demonstration. I'll be operating in my center, which is situated in 9th Cross, Malleshwaram. And the auditorium, all the audience all over the world, they come and they'll be watching. As the professor said, this time it was 1,133 delegates were there. I am so happy to be associated with the Vecha Center. And with these few words, and also I thank Professor Satish sir, today is not there, for this kind invitation. And the main man behind this is Professor Parameshwar sir. So I'm going to speak on environmental risk factors for hearing loss, measures to mitigate. And also, one of my close associate friend, John Panikkar, the national chairman for NISS India, and he's done a lot of work. And most of these presentations I have taken from him also. So this World Hearing Day, 3rd March was the World Hearing Day, and the World Hearing Day is a changing mindsets. Changing mindsets is crucial for improving, assess, and reducing the cost of unaddressed hearing loss. Let's make ear and hearing care a reality for all. But as Professor Srinivasan sir told, each and every word what he said was golden words. So it's very easy to tell, but very, very difficult to implement. I don't know why many of the people, they don't give much importance for hearing. So at the end of my talk, you'll know why it's so. These wordings are from WHO Director General Tedros. Hearing loss has often been referred to as an invisible disability. That is, this word is a golden word, invisible disability. Not just because of the lack of visible symptoms, but because it has long been stigmatized in communities and ignored by policymakers. Because of the stigma, it has been ignored, and this is how people, they don't give much importance for hearing. The deafness burden. Hearing acumen is the most important sensory input for the brain to be healthy. About 400 million people have disabling hearing impairment globally. In Southeast Asia, deafness prevalence is 6 to 9%. In India, 6.5% people have significant hearing loss. What is significant hearing loss means? If the hearing loss is more than 50 decibel hearing loss, that is significant. Noise-induced hearing loss is the most common preventable hearing loss. That is a very important word. This can be prevented, but noise-induced deafness, if you are aware of what is this, how it causes hearing loss. So that is very, very important. So the main talk is how to prevent this noise-induced hearing loss. 30% of permanent hearing loss is noise-induced hearing loss. Presbyacusis is indirectly noise-induced. What is presbyacusis means? In elderly patients, they got sensory loss, that is called as presbyacusis. The sound levels. The sound levels are measured in decibels. These green things can be taken as normal. The normal speech level will be between 40 to 50 decibel. When you shout, it may go up to 50 to 60 decibel. Ordinary car horn up to 70 decibel sound levels will be transmitted. Whereas red color things is dangerous or hazardous. Air horn 100 to 110 decibel. In Melas, it is 110 decibel. Busy street noise, that is the maximum what you get, about 110 to 120 decibel loss. So coming to the anatomy of the hearing, the most important thing is ear is divided into 3 parts. That is outer ear, middle ear, and inner ear. The mechanism of hearing is the sound when it goes through the ear canal. This is the ear canal. This is called as the external auditory canal. From external canal, this is called outer ear. This is middle ear. In between outer and middle ear, there will be tympanic membrane. This tympanic membrane vibrates, and the sound will be transmitted to the inner ear, not directly. God has given such a wonderful mechanism to indirectly transmit the sound to the inner ear. So for that, there is a small bones are there inside the middle ear. This is called smallest bone in the body. One is called the malleus, another one is incus, and another stapes. Stapes is called the smallest bone in the human body. And all these three are interlinked. Directly it will not go. There is a joint between the incus and malleus that is called inculumalleal joint. There is joint between the incus and stapes that is inculustapetal joint. And this is called a foot plate. This is like a door to the inner ear. So when the sound hits the drum, all these three will vibrate, and these stapes will go vibrate, and the foot plate vibrate, and the sound will go to the inner ear or cochlea. This stapes has got a tendon. So the tendon, it is like a brake. So it can withhold the sound up to the 120 decibels. So suppose if the sound is gone beyond 120 decibel, the brake will fail. When the brake fails, car will keep moving. So like that, if the sound is more than 110 decibel, what will happen? The stapes will lose the function. The stapes tendon, that is exactly like a brake. So it cannot break, and the brake will not be hold. Then the stapes will move violently, and they'll be that causes damage to the inner ear. That's how this noise pollution occurs. So then once the sound goes to the inner ear has got a cochlea. It is like a coil, and this is lined by hair cells. These hair cells are convert vibrations to electrical impulses, which are then sent to the brain through the auditory nerve. This is the auditory nerve. This is how the sound has been transmitted from the outer ear through the middle ear and inner ear to the brain. This is the normal anatomy of the ears. So as I told, the role of stapedial tendon is very, very important. Again, I'll show you a cross section. This is a tympanic membrane. This is the malleus. This is called inculumalleal joint. All these are suspended by ligaments. Even though it is so tiny, under microscope also we cannot see like this. So it is the tiny, and these are the ossicles, this malleus, this incus. This is called inculustapetal joint. And then this is called the stapes, and this is called the foot plate. From here, they will go to the inner ear. What I was talking about was the stapedial tendon is the brake. This is a very, very important tendon. It can, you told the stapes not to move beyond if up to 120 decibels. If the sound is beyond 120 decibel, it cannot control the movement of the stapes. And the stapes, if it moves few millimeters inside the inner ear, that can cause giddiness, vertigo, vomiting, and also sensory loss. So this is a very, very important bone, and the most important, this diameter of this will be, if you take it will be anterior posteriorly, it will be less than 8 millimeters and 4 millimeters. We do a surgery in this tiny area. There are two types of hearing loss. One is called as conductive hearing loss, another is called as nerve hearing loss. Whatever conductive hearing loss is there, with the technology, with the surgical technique, that can be reversed. So conductive deafness will be confined to the external ear and middle ear. Nerve deafness will be confined to the inner ear. So nerve deafness, nothing can be done, no surgical intervention or no medicine. Anything with the middle ear, we can do wonders with my experience. For example, we do a surgery called stapedectomy, where this foot plate will be fixed like a rock. It will not move. Then it doesn't move, patient will be hearing loss will be there, even up to 60, 70 decibel. For that, we do routinely in my center, average every day I do one case of this stapedectomy, where we make a 0.6 mm hole in this foot plate, and we remove the suprastructure. From here to here, we put a Teflon piston. The moment we do, the sound will be transmitted to the inner ear. On the table, patient will hear. This is a really miracle surgery. So as professor was telling about the glue is also, it is a fluid inside the middle ear cavity. The middle ear cavity is a air-filled cavity. In children, because of the allergic problem, the eustachian tube will block, and instead of air, it will be filled up with the fluid or glue. Even that glue, we make a small nick in the eardrum and we suck out that glue. The moment we remove the glue, the child will hear. So that is all, whatever is there in the middle ear. We get lot of diseases in the middle ear, like eardrum perforation, cholestoma, all these bones would have been destroyed by the disease. With present technology, that too in my hands, we can reconstruct the eardrum to near normal, and also we can reconstruct these ossicles to transmit the sound from the middle ear to the inner ear. So, friends, whatever pathology is there in the middle ear and outer ear can be reversed. So, whatever happens in the inner ear, then there is no any surgical intervention or there is no medicines. So this is how this sound will be transmitted through these hair cells. These hair cells are very, very important. What is this hair cells is? These hair cells, these are the hair cells. So this will be situated in the inner ear. So that will transmit the sound to the inner ear, to the brain. Okay, now from the cochlea, this is audited now. This is the cochlea. From there, this auditory nerve will conduct the sound. First, it go to the brainstem in the cochlear nucleus. From the cochlear nucleus, it go to the midbrain. There, it is called inferior colliculus. From inferior colliculus, it will go to the cortex, the medial geniculate body in the thalamus. From there, it will go to the auditory cortex, where the sound will be transmitted to the cortex. So this is the pathway of the sound, how it will be transmitted to the brain. Now, the sources of noise pollution. The most important is traffic, road, rail, and air. Loudspeakers are very commonly, that is one of the common cause, where the decibel sound, if you see the loudspeakers in some of the places, it will be more than 150 to nearly 200 decibels. The religious and social ceremonies, there also you can see that so much of very loud noises will be there. And industrial factories, construction activities, and machineries, these are all the things which generate a lot sounds. High decibel music. Nowadays, this is a very common thing which we see, because younger generation, if you go to any hotels or pubs, everywhere, this high decibel music is a very common thing, and people enjoy that, but they will have to pay the face the consequences. Particularly nowadays, if you see, these pubs are coming like mushroom. So particularly you walk in a street of this Jayanagar, this JC Road and all Jayanagar, there's one street where it is full of pubs. The whole street will be vibrating when you go there. This is the mechanism. But like mushroom, it is every alternate days or every 15 days when new pubs are opened. So this is how the sound is being, the high decibel music sounds are the main cause for hearing loss. Home noises like TV, radio, music player, high-speed fan, air conditioner, and home appliances. The personal music player, earphones, AirPods with high volume. This is another common thing in my practice, which I see, particularly in younger age group. They enjoy using music, but I have seen in of late, say I can say in this last 10 years, the incidence sensory neural loss is seen in younger age group. You see, every time they'll be holding this thing, who are hearing with the headphone, particularly this IT people, always they'll be using headphones, and they're exposed to noise continuously. And all these people, they are developing sensory loss. That's a very common cause of late I'm seeing now, is because of these headphones. So I totally condemn that headphones, but it's very easy to tell, but very difficult to implement. So I can tell the patient, but nobody is going to agree for that. Or this is life. They want to enjoy the life. So they want to use the music wherever go, even walking, dancing, everywhere there will be earphone in there. What is the consequence? They come say that my ear is blocked when you see that hearing loss. But these things can never be changed for in this younger generation. I have seen, I failed counseling then. I like a fool, I'll be telling, but nobody listens. That is the scenario of the present generation. The source of noise pollution. Yeah, it is. Personal music players is the very common thing which causes ambient noise developing nations. The ambient noise in developing nations, high ambient noise in cities 70 to 110 decibel, lack of awareness, lack of prioritization by authorities. That is very, very important. Nobody is bothered about this. Whatever you say, nobody will give their ears. You can tell, you can organize meetings, tell that they hear in 1 year and they leave another year, because not much of importance is given for this hearing. This is, for me, it's a waste of time. Ambient noise is developing nations, high ambient noise cities is a lack of awareness and lack of other. Health burden due to noise. Serious physical, mental, and social effects because of noise on human and animals. Recreational noise is the leading cause of developed countries. As I told earlier, this is become a very common thing. Traffic noise and loudspeakers are important sources of noise in developing countries. Health burden due to noise. Sudden exposure more than 85 decibels, sudden sensational noise, it's called acoustic trauma. This is also very commonly we see. Particularly, for example, I see a lot of patients. If suppose they have attended some function where there's a big music band was there, next day morning they'll come, they'll tell, sir, I got tinnitus. And if you see, the hearing loss will be there. Recently, one of my close friends, brother and sister, brother-in-law and sister, they were sitting on the stage. Suddenly there was some crackers they burned. Both of them, they had severe sensory loss. This is how sudden exposure to loud noises. If it is more than 85% dozen, there are chances they lose ear. And these are irreversible. That is the most important thing. Most of them are irreversible. So that is the pathetic condition. The chronic exposure, more than 50 by decibel hearing loss. That is carpenters, plumbers, and coal mines. These are the people who are constantly for over a period of time, they'll be exposed. And particularly these weavers. I see a lot of weavers, looms paper, they come. Whole generation, family, people, everyone will be having hearing loss. Because most of them, they live in the same premises. That looms, you must have seen, the sound will be continuously taka, 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 taka. It will be going on that. They'll be hearing that sound. Whole family members, particularly in Dodbalapur, there are more than 100 families are there. Almost 80% of them, they have sensory loss. But if you tell them that is their profession, they cannot change that. What are they going to do it? They have to live with it with the hearing loss. It's very, very difficult to change these things. It is impossible, I can say. They say, sir, I have been working here for 20 years. This is my profession. What can I do? I cannot change my profession. This is my bread and butter. So what then? There is no, we are helpless for that, but they have to continue that with the hearing loss, and they may have to go for a hearing aid. See, that's ear muff. See, the nerve conduction can be transmitted through the cortex. Even if you put the sound, it will be transmitted through the cortex. To certain extent, yes, it prevents. But in reality, what happens? A person who is doing some particular work, he has to listen to that sound also. Then only he can coordinate his job. So if you block his head, he will not know what is happening there. So it is like blocking. They cannot do their professional work with mask. It is easy to say mask. Okay, you tell mask, you tell them. You go and see. I have seen this particularly. Go and see. None of them will be wearing mask. So this easy to tell, but it's very difficult because 8 hours a person is working with a mask. Means, for example, when this COVID period came, it was for us so difficult to use a mask for a long period and sit. It was suffocating. So the same way, they cannot use it. It is very easy to tell, but in reality, most of them, they don't use it. Commonest military hazards is high intensity noise, such as small arms fire, improvised explosive devices, or artillery fire. These are also commonly we see in military people because of the professional thing they develop a lot of sensory loss. Health burden due to noise, serious physical, mental, this is audiological effects of noise. What will happen when you are exposed to noise? sensory neural hearing loss. As I told, the sensory neural hearing loss is the inner ear problem. Conductive loss is the middle ear problem. The middle ear problem can be rectified, whatever it is, by surgical means or by medicine. Whereas sensory neural loss, nothing much can be done except hearing aid, or I'll tell you that later. Acoustic trauma. Acoustic trauma means that's what if you are exposed to loud noises more than 110 decibel, that causes acoustic trauma and thereby causes sensory loss. When there is acoustic trauma, this hair cell will die and that will give a sound called as tinnitus. This is really annoying. People who have experienced this tinnitus, they will know. These tinnitus patients, they will have a suicidal tendency. In my experience, 3 of my patients, they have committed suicide. So that is the this thing of the tinnitus. So even when there is a severe hearing loss, see the labyrinth is the one which maintains the body balance. So suppose when they got sensory neural loss, 2 labyrinth will be there in the body. So once the labyrinth loses its function, so it will become weak. So I compare that like you have 2 legs. If one leg is not functioning, you will not have balance. The same way, if the labyrinth is lost its function, they'll not have balance. That is the reason they get the severe vertigo. This is also one of the common cause of sensory neural hearing loss. These are the hazards of the sensory neural hearing loss. Audiologic effect, hearing. Effects are depends on loudness, nature of sound, duration of time and disturbance, total exposure in lifetime. Audiologic effect on hearing. Temporary threshold shift, temporary hearing loss. It occurs immediately after exposure to high level of noise or a sustained sound. For this immediate loss, as an emergency, sometimes there is a treatment. So if the patient comes, this is called a sudden onset deafness. This sudden onset deafness can occur even without exposing to the loud noises. Particularly, it can happen if you are exposed to cool breeze. This is a very common thing we come across. This is called sudden onset deafness. For example, recently a doctor dentist, she was traveling from Kolhapur to Bangalore in an AC bus. Morning she came. That is, she was a daughter of one of my pathology professor. So both the ears she had got lost. That is exposed to cool breeze. What happens is this God has given this cochlea one single blood vessel. This is called cochlear artery. In the human body, all the vessels will have branches for any blood vessels. But unfortunately, God has given a only single vessel, thin vessel, which doesn't have any branches. So due to exposure to cool breeze, there will be vasoconstriction. The blood vessel will constrict and the ear will lose the hearing, the blood supply and oxygenation. Then they suddenly lose hearing. That is called sudden onset deafness. In otology practice, this sudden onset deafness is one of the emergency. That too, if diagnosed properly. 95%, most of them, they don't diagnose this sudden onset deafness. What happens in the sudden onset deafness? Patient will lose the blocking. More than blocking, they'll have severe vertigo, vomiting, and this thing. So once the patient has got vertigo, vomit, they'll go and get admitted. Some physician will see, they'll give drips, everything. Nobody bothers about the hearing. So only if they come to an ENT surgeon, then we'll know. So for that, we have got a treatment. If sudden onset deafness, we give intratympanic dextran injection and high dosage steroid. 95% of the patients, if it is given well in time, say about within 72 hours, 95% of the patients, they get back the hearing. For example, the same girl, what I was talking, she's a dentist. Both the years I gave, both the years it became normal. And also I'll tell one example, my own friend, he's in Australia. He was in a very close friend of mine. His name is Dr. Balaji. He's a nephrologist, leading nephrologist. Over phone, he said, Rijendra, I lost this hearing. There, nobody was ready to give injection. Then I told, please come back. He took a flight. He came to Bangalore. Midnight at 2 o'clock, I gave injection. I gave 3 injections. Believe it or not, he regained his hearing. So this is why we call this as an emergency, sudden onset deafness. The cause for sudden onset deafness is particularly exposure to cool breeze. So that's why in the older ages, people used to say, cover your ears, Ulla. These people, they don't believe. And people traveling with the AC car, AC bus, traveling the car with the open window, all these people will experience this sudden onset deafness. Of late, I am seeing a lot of cases sudden onset. On an average, every day we give injection. Today also we given for 2 patients. So that is because we diagnosis is very important. So this sudden onset deafness can be reversed if treated on time. The same patient, if he comes after 15 days or 1 month, nothing can be done. That will be permitted.
This is common among Jawans on the border.
Yes, those people who are exposed to cool breeze. Gone. Even one example is one lady, one of my friends' mother-in-law, just she took a ice cold water, she drank, suddenly she lost her hearing. These are the things you should be very careful. This temperature, these shifts usually involve 3 to 8 kilohertz range because high frequency loss will be there in 3 to 8 kilohertz, may resolve within minutes or hour or may not. Complete recovery depends on the degree of shift and type of noise trauma, that which I have already told. Audiologic effects of hearing, permanent threshold shift, this will skip this. Audiologic effects of hearing is acoustic trauma, presbyocusis, that is old age deafness in cumulative effect, and tinnitus is these are the common problem. Coming to the pathogenesis of sensory neural hearing loss, mechanical damage to cochlea, vasoconstriction and decreased oxygen availability cause damage to the, that's what I told. If you take a cross section of the cochlea, this is a cochlea. If you take a cross section, then these are called as the hair cells. The sound will be transmitted through the hair cells to the auditory nerve. This will be ciliary movements will be there. So what happens because of exposed to these loud noises, this ciliary mechanism or the movement of these hair cells will be lost, and that causes sensory neural loss. That's how the sensory loss is called. Nerve loss is called because the damage to the hair cells in the inner ear. Audiological, sorry. Mechanical damage. This mechanical damage, rupture of the tympanic membrane, rupture of the ossicular chain, rupture of sound window, round window, disruption of organ of Corti, damage to hair cells. This mechanical damage, again, because of exposure to loud noises can cause. We have seen cases where there will be a perforation of the tympanic membrane. You can see that the tympanic membrane is perforated because of the exposure to loud noise. Sometimes even the tympanic membrane can rupture. Even the same thing can happen in what is called as barotrauma. People who are deep sea drivers, they will all develop this barotrauma where the tympanic membrane rupture. And also, this is also another case where the tympanic membrane is ruptured here. Tympanic membrane. What happens in that case is these are the hair cells here. Here you can see these hair cells will get damaged, and once the hair cells damage, that causes a nerve loss. So rupture of tympanic membrane, this is again it is rectifiable. So suppose if you see this case, if the tympanic membrane ruptured under microscope, we approximate this ruptured margins and then put a gel form. 99% it's closed, and if it is a most of them they allow a conductive deafness that will be rectified. There may be associated nerve loss also be there. That depends upon the after closure. It may help permanent. Rupture of the ossicular chain. See, this acoustic trauma is so much, it is unimaginable. Sometimes we are seeing because of very loud blasts and all the ossicles would have been disrupted. The ossicular chain will get disordered because that will be the impact of the sound. That also can cause total hearing loss. Rupture of round window is another window that is like a to the inner ear. Sometimes it has got a very thin membrane, even because the sound it can get ruptured. That can also cause dead ear or a complete this thing. Then coming to the inner ear, disruption organ of Corti and damage to the hair cells, as I told earlier, all these things can cause mechanical damage. The diagnosis of now neural hearing loss, history of prolonged noise exposure, bilateral high frequency sensory neural deafness. Initially, it affects 3,000 to 4,000. This is a very classical audiogram. When you see a sensory, normally the audiogram will be straight like this. If you take it, it will go straight. The red is right ear, blue is left ear. So when you take in a people who are exposed to loud noises for a long period, this is a very classical graph we get. This is a high frequency dip will be there. So this is how it will dip here. So if you see this audiogram, the moment we see, we'll ask their profession, and this is a very common thing which we see. All these are irreversible damage. Nothing can be done for this. And even these cases, hearing aid also will not help. What happens, why hearing aid doesn't help is this low frequency, the hearing is normal. The high frequency hearing is lost. What is the practical problem? The high frequency is at the distance of 5-6 feet, he can hear sound, but the clarity will not be there. And if 2-3 people are speaking, they'll hear a jumbling word. They cannot hear properly. Only one-to-one they can hear. For this patient, I cannot give hearing aid also. Why we cannot give hearing aid? Means the low frequency is normal. When you give hearing aid, this low frequency go above, so it will be too much disturbance. So this is a very incurable problem. They have to live with it because there is no medicine, there is no surgery, no hearing aid going to help. This is a very common thing we see in a people who are exposed professionally for a loud noises. Diagnosis of sensory neural illness. The clinical examination, history of noise exposure. The moment I see the audiogram, I can say it's noise exposure. What will do for noise exposure? A person after 30 years, a person working in a factory, he comes to me after 25-30 years with sensory loss. Nothing can be done. I cannot do him helpless. Nor I cannot tell them you just stop your work. Already he has worked for 25-30 years. He cannot leave the job. He has to continue. Only thing we have to, we'll give sometimes letter to avoid exposure to loud noise or change his job to a different place in the same company where he is not exposed. That's the maximum which we can do. But whatever damage has happened is a permanent damage. It cannot be reversed back. Aging is also very commonly we see in aging, particularly in diabetes. Ototoxic drugs, certain drugs are there which can cause this particularly earlier we used to give streptomycin. All these anti-tubercular drugs, rifampicin, all these things can cause gentamicin or all are ototoxic drugs. So whenever you're giving these drugs, you should not give it for a very long period until and unless it is required. Peripheral ototoxic, peripheral neuropathy, very commonly we see in diabetics. So most of the diabetics are long-term follow-up, all of them, they will have a sensory neural loss. That's one of the complications of diabetes is sensory neural hearing loss. Simple test, how to do is we do a tuning fork test. We'll do a different frequency tuning fork. So with the tuning fork, we can very clearly diagnose the sensory neural loss, and pure tone audiogram, what I showed, is a must to diagnose the sensory neural hearing loss. Is sensory neural hearing loss other system effect preventable? Awareness of this other the health issues, use of personal protection, earplug and muffs, move away from sound sources. It's very easy to say. Special protection of children and pregnancy and old age. This is very, very important. Particularly the pregnant lady should not be exposed to loud noises because the womb, the children, after 3 months, the ear will be developing. So at the time it is exposed to loud noises, that can cause congenital nerve loss also. That's why you should be very, very careful. The pregnant lady should not get exposed to very loud noises. Particularly, they should not attend any conferences where they music concert or anything where they're loud. And regular auditory checkup, audiology checkup is necessary for elderly patients and diabetics to know what is happening. Coming to the prevention, how to do. These are the causes, how you do everything. So coming to prevention of this, that is the main topic of the day. We have got a National Initiative for Safe Sound. NISS means National Initiative for Safe Sound. This we started in August 2013. The pioneer initiative in the world, joint project in Indian Medical Association and Association of Otolaryngologists of India, that is ENT Association and IMA put together. We started this National Initiative for Safe Sound, and the main chief person is Don Panikkar. He is the main man. Still, he is working on. He is the pioneer and he is the backbone for this NISS. And most of the slides which are taken is from his collection. So activities of NISS. So how to prevent? We are trying our best, but we are not totally succeeded. So what are the activities of NISS is students awareness program. From the childhood only, you should keep teaching them awareness is very important. So seminars and interaction, information booklets, and students pledge for ensuring safe sound. These are all you should nicely bring it to the mind and children mind, so that if you bring it at the the school level, that will get registered, and at least 70, 60, 70% of the children when they grow, they will implement these things. That is why this is the main thing is you should completely first awareness for the program for the students is a very important program what I done. The timed activity, the timetable cards with the slogans to school students. All the timetable card, there'll be a slogan behind that. So awareness of the hearing, prevention of the hearing loss, that awareness should be there. All these things should be day-to-day this thing if they see, then it will get implemented over a long period of time. Then the teacher awareness in school, that is very important. You should make the teachers aware, so they should teach the students about the sound noise pollution at least once in a week, at least 30 minutes they take about this noise pollution and everything. Then that will get nicely registered in the mind of children, and at least they will implement. Then activities awareness, cycle rally about the noise pollution, and also walkathon. This is protect hearing. This is all done. And then activities of NSS, public awareness. That is very important. Publicity of videos, visual and print media discussion, newspaper articles, social media campaigning with youth organization and helpline. Now helpline has started. So if you encounter any very loud noises nearby or close to your house, you can immediately call them. Here it is the same, you can call to the police, or also for another organization is there. If you call them, they will come to a rescue. So we can inform them by helpline that to avoid this loud noises which will be occurring in and around your daily living. So this in the noise pollution minister launches IMA helpline, and also it is this IMA helpline is done in also Delhi police. They have got this IMA program. So activities of NS advertisement boards in public places, information booklets, seminars and interactive sessions for the public, and activities, these awareness programs involving celebrities. Sometimes this also gives a very good impact, because people nowadays, they were big fans for so many celebrities. If the celebrities sell, it goes into their mind and they may implement these things. So this is, I can see this here, very good famous Malayalam actor, and also our famous cricket player Dravid. He is also owned this giving publicity. And then no horn day was done. Every year we do no horn day. So that is in the month of March only. So we publish that in no horn day to avoid horning. That is very important. So this is our police, Bangalore police. ಶುಭೋದಯ ಗೆಳೆಯರೆ, ಈ ದಿನ ಸೋಮವಾರ ಅನಗತ್ಯವಾಗಿ ಹಾರ್ನ್ ಬಳಸಬೇಡಿ. Don't use good morning Bangalore. It's no honking Monday. Please avoid honking. This is how it has been advertised, and to certain extent it has been followed. Activities of no horn day involving police officers. That is also very important. Police should get involved in this. Involving the government agents. Enforce the law strictly. That is very important. If it is done, definitely it will be of useful. Noise pollution regulation and control board. This regulation control board is there. You can call that rules 2000, where they have to interfere. Suppose if there is loud noises are there, if they are informed. No amount of legislation will be helped unless the public is convinced that noise is a menace and takes step to curb it. That is very important. Public cooperation. This is again silent zone designed by city, noise awareness day observation. Then provide sound measuring devices to revenue police officers. This we are given to police officers to assess what is the noise exposure. This has been done law for giving to the traffic police who stands in the signal, and we can, at the end of the day, we can assess what is the sound exposure they are done. Outcome of last 10 years campaigning is the average ambient noise level in 10 most noise points in various cities measured at the busiest time of the day. That is in New Delhi, Mumbai, Chennai, Gurgaon, Trivandrum, and Kochi. It has been done. See here in 2014, it was 94. In the average of 94 was there in all the cities. Whereas after this educating about the noise pollution, now it has come in 2023 in all the cities. If you take average, it is come to about 82. That is a very good result. So if everyone continues this, still we can bring down this. This is our Bangalore, this thing. In NIMAS, I strongly doubt about this much small, because we have done a lot of work all over the world in India. So where it is a range between 70 to 80, this is in Indira Gandhi NIMAS silent zone, it is 28.6 in that the different types they are taken. So industrial area, it comes to 75 dB, commercial 65 dB, residential 55. So this is somehow it is this thing correct. So same thing in the different places has been done. This is in the Bangalore city. Coming to the conclusion, ambient noise level in cities of developing countries are far above the safe levels. Campaigning involving medical professionals and other health workers have high impact on the society. Imparting awareness to the teachers and students is highly effective in influencing the society. This is the most important thing, and really this is the one which is working. Along with public awareness, enforcement by the government and judiciary are important. This doesn't work. Programs implemented by IMA Safe Sound initiatives has been highly successful in reducing the ambient noise to a significant level. IMA and NISS may be considered a model project that can be replicated in other developing countries to prevent this sensory neural hearing loss. Thank you very much. Thank you very much for your patience with me. Thank you.
You all heard what a wonderful talk, some of the experience explained. Any questions, please, because of the time?
I'd like to ask you, like you undergo a regular blood test, you undergo a regular hearing test? Can you make that compulsory?
Yeah, particularly diabetics after 60 years, I mentioned that it is better to get audiogram done. But the society, what happens is nobody accepts that they are not hearing. A patient comes to their parents, wife will be telling, sir, sir. That fellow said, no, sir, she is not. I'm hearing. See, you're talking, I'm hearing. Nobody accepts that he is not hearing. So I tell them, hearing is not a problem for the patient. It is the problem for the family members. They have to shout. That fellow will be keeping the TV volume very loud. He'll be enjoying at that for 50, where it will be so much annoying. So nobody accepts that. That is the scenario of, as well as this is a scenario in the nerve loss patients. So nobody accepts it. And also second thing is, nobody accepts to go for a hearing aid. They wear spectacles, whereas nobody accepts it. That is the stigma. Nobody accepts. That is very, very difficult to counsel the patient for a hearing aid. So forcefully, I'll never give hearing aid. If a patient says, a particular lady, sir, nange beda sir, nan kelte sir, you whatever hearing aid you give, they'll never use it. They'll go and throw it. This is my experience. So that's why if a patient says first time no means I'll never give. I'll tell that attendant, see, even if you buy it, it will going to be a waste. She's going to throw it. This is my 30 years experience. The moment I see the patient's face, the first impact, it's a son, that patient, whatever you give, or else even if you give, they will give some lay excuses, telling that, sir, it's too loud, sir. I cannot hear, sir. All these lay excuses, they want to throw it. This is the scenario.
But you
So,
wear glasses.
yes.
So what a problem with hearing it, I don't know.
Yeah, that when it comes to you, you know it. So that is how patients, that somehow this hearing meant everyone, and also a patient comes with a for each hearing loss, we have got different types of hearing aid. Suppose a patient has 50 decibel hearing loss. When inside the ear canal, hearing aid will work. The patient is 70, 80 or so, everyone wants invisible. They want inside there, where it is not good health. But I'll never give, even if they insist, because it's not good health. Whereas they go to some commercial thing, they will give it, but he'll be wearing it, but he'll not use. I have a simple example I give. See, what is your shirt size? 42. If 36 is good, are you going to use it? You cannot use it like that. This is the very difficult. Most of them, they don't accept it. Once if they get used to it, they'll get addicted to it. That is 30-40% of patients are there. Without 1 minute of hearing aid, so they have to get used to it. Particularly in the younger age group, it is very difficult to counsel them, particularly young females, unmarried females. It is very, their life will be ruined if they wear a hearing aid. That is the scenario. And one more thing I forgot to tell, there's a condition called as childhood deafness. That is totally a child born with a deaf and dumb. Now we are doing cochlear implant for them. That gives excellent result. But only thing is it's very, very expensive. It costs about 11 to 12 lakhs. The government is giving subsidy at 5 lakhs. But to get that, a big process is there. In last year, the government has given only 160. There are more than 7,000 patients are waiting in this. But these are the things. The cochlear implant is a solution for children who have got total deafness, where they cannot hear, they cannot speak. And if you have to do it within 5 years, not after 5 years. So within 5 years, if you do cochlear implant, they'll be like a normal children. That is the greatest thing. And also an elderly patient, a patient who has developed speech and he has lost both the hearing. There also, where if you are lost both the hearing aid also of no use. You cannot give it, because that is all in that situation also. In elderly patients also, we do cochlear implant, they hear very well. That is one, the solution is there for even total dead ear, where cochlear implant can be done.
Thank you, sir. If there are no questions because of the time factor, I think some of the things, I still remember my village during winter time, cold season. My house was near the lake, and 16 acres of land was there. We took a paddy lake. Always my grandfather said, cover your ears, cover your ears with the cold air. Now I realize why it is. I think our friend in Australia is lucky to come over here, fly, get the operation within 72 hours. I think that's something elderly people, the experience they talk about, and scientifically has been proved now. It's something to good about it.
One more thing,
Yeah.
sorry. And then another condition, what you get in the ear, if you're exposed to cool breeze, is what is called Bell's palsy.
That's what.
So they'll have facial nerve palsy. This is also when you're exposed to cool breeze. So next morning you'll get facial palsy. That's called Bell's palsy. That is also very commonly seen. You are exposed to very cold breeze. That's why you have to protect the ears. Again, this Bell's palsy is 80%, 80% they recover with medicine. 10 to 20% they don't recover. So for the 10 to 20%, I do surgery. I'm authority in the world for this Bell's palsy surgery. I do surgery and bring back their face to normal. So that is my own this thing I had done, and everyone all over the world, they're following the technique. So we do surgery for unrecovered Bell's palsy. There are about 80% they recover with medicine, and only 10 to 20%. For example, if you see Baba Ramdev, he has got facial palsy. Our Chief Minister, ex-Chief Minister Bangarappa, he had all those people, nothing has been done. So now you can do surgery for that for recovery.
And also, while covering, you did mention about pregnancy.
Yes.
Definitely, pregnant mother exposure, rock music, and all these things, more than 110 decibels, their children have deafness.
Correct.
And also, this sound has got a cumulative effect. And another thing is ozone has a cumulative effect. This has got a cumulative effect. And something I think the industry, I was the chairman of the technical advisory committee of Karnataka Pollution Control Board 2000 for 5 years. During that time, every industry, every year after get health related issue, hearing test. It has to they have to give it. That included in that situation. And also 2005 as a chairman of the World Bank Karnataka State of Environment Action Plan, I was the chairman of health sector. air, water, soil, sound, we included.
Okay.
And society, especially community, religious people are very against that. We included slow line, Supreme Court judgment have come there, and not to have more than 110 decibel in that one. And 1998, we had an international conference in this in town hall. In 9:30 a.m., we measured this thing. It was 110 decibels at that time. In 9:30 in the morning,
Which year, sir?
1998.
Imagine now.
Yes. So anyway, you covered it very well. I think blue ear, children, they are clinicians, elderly people. How about the small children? How do we pediatrician handicapped? How do you recognize it? Refer those children to you. I think these are some points I have it. This I presented in the last year in your conference. That's 1 year. How do you recognize small children? They don't know how to speak tinnitus and anything like that. How do you recognize we pediatricians? And we recognize by watching the change in their behavior, sudden change in the behavior pattern, number one, and the excessive sleepiness. Number three, lack of concert. They don't focus on anything. Fourth, they want to play alone. They don't want to mix up with other children. And poor response to call. When the mother, grandmother call, they don't respond that well. And want to turn off the volume of the TV and all these things.
Very common thing.
Very common thing that we have to observe those things.
Now they will move very close to the TV.
And also talk louder. So these are all some of the indirect clues we pediatrics recognize. And these are all children, lot of allergic nose problem. I refer to them for blue ear. That's one of the most common cause in children. And thank you very much covering it so well. We thoroughly enjoyed it. And on behalf of the Indian,
Yes, I think you mentioned that congenital deafness, whether it is due to a condition called hereditary hearing impairment or
That is congenital hearing loss is not hereditary. It is embryological.
neurological. So exposed to this kind of pollution.
Pollution, not only that, even there's so many embryological factors like anomalies, it is another anomaly. Not development of the cochlea now. The cochlea now would have been not developed.
and also I think we have a great pleasure extending invitation for attending here. Pediatrician, Dr. Georgia consultant. He is the president of the Commonwealth countries Pediatric Association of our country. Now he is the chief advisor to the Commonwealth countries, ComHand, health related issue. Welcome. Thank you, sir. Sir, on behalf of our institution, I request you to hand over a small memento for Vijendra, who had done a wonderful work. We learned a great deal. Let's have a picture. All of us.